of this 21 days faculty development program jointly organized by NADCL and Atari Zone 8 Pune. So I welcome you, sir, and I will just read out your make your brief introduction to the participants. So Dr. GIRISH YADAV, veterinarian. Now currently he is working in the position of assistant professor in the Department of Surgery and Radiology, Mumbai Veterinary College, PAREL, under the aegis of MAFSU, that is Maharashtra Animal and Fishery Science University, Nagpur. So he has been in teaching, research and extension for past 27 years, and he has published several research papers and articles. And also he has 3 books to his credit, and he's been a guide to 5 PG students, and he's been in the member of the 9 PG students. So also he has received 17 different medals for his research work, and also he is closely associated with KVK Thane and Palghar, and also for the farmers and the stakeholders. He has organized different camps, health camps associated with the small ruminants and the large animals also, so for the benefit of the farmers. So I heartily welcome you, sir, and he will be giving his talk on the first on-farm primary treatments for intensive livestock farming. Okay, sir, you can start, please.
Thank you. So, good afternoon, one and all. The topic of today's lecture is on-farm primary treatments for intensive livestock farming. So, whenever you are working in the livestock sector, so the farmers, animal owners, dairy farmers, or the rural women who are rearing the goats and cows, they are getting so many difficulties in day-to-day
This
treatment.
call is now being
The
recorded.
veterinary treatment centers or veterinary hospitals, they are located far away from their home or their sheds or farms. So many times it may happen that the delay in the treatment of this one animal, particular animals, injured animals or diseased animals, this may lead to several conditions which are threatening to the life of the animal, or they may cause extensive losses in the livestock. So to prevent this, we can come to know, I can say no, these primary treatment for the livestock farming, and these primary treatments we can suggest to the dairy farmers, animal owners, and the persons who are rearing the animals for their day-to-day income. So the first aid treatment means immediately it should be performed. So any injured animal or any sick animal should be treated immediately till the veterinarian reaches to the farm. So veterinary, you should, in case of several disease condition, you should call the veterinarian for the treatment. But by the time you can perform this type of treatments, and you can save the life of the animals and reduce their pain and suffering. So if we suggest the farmer, or if we perform the first aid treatment for the particular animal, then we can, along with saving the life of the animal, we can prevent the situation from deteriorating and further promotes recovery to the any animal. Means the disease condition will not be aggravated, will not be, you can say become more worsen, and this can be prevented by means of this. So in case of life-threatening emergencies, also first aid treatment is required, but immediate, you can say immediately the veterinary should be called, and animal health workers or veterinary workers should be called over there, and treatment should be performed. So this treatment can be performed in case of the infectious, non-infectious type of diseases, wounds, electrocution, burns. So these are the very common type of the conditions which occur at the farm. So this is the first aid kit for the treatment. If it is available, that is better. If it is not available, then it's okay. So the important things like antiseptics, these gauze bandages, skin cleanser, you can see small saline bottle, this pastel water, antiseptic ointment, anti-bloat ointment, then rolls of medical tape, fly repellent ointment, syringes, cotton, antibiotic eye ointment, thermometer, drenching bottle. So irrigator, these should be available at least, or if possible, all should be available. So the first condition, which is most commonly occur in case of the livestock population, is a simple indigestion. So in case of simple indigestion, uh, this type of the disease condition or this type of the condition occurs due to abrupt change or sudden change in the quality and quantity of the diet. Uh, it occurs due to excessive feeding of the grain. Many times it may happen that grains, animal eats excessive quantity of the grains, silage, or there is in case of drought prone area or where this water is not available, then sufficient water intake is not there, and a prolonged use of antimicrobials or we can say antibiotics may also lead to this type of indigestion. So the most common signs of this indigestion are number one, there is anorexia, means animal goes off feed, doesn't eat anything, doesn't eat or drink water, or it is water intake, feed intake is reduced. So in case of treatment plan, spontaneous recovery occurs when the animal is fed with a roughage rich diet. Then manage it with the medicine like sodium bicarbonate. So in case of the sodium bicarbonate in the indigestion, in case of large animals, cattle, buffaloes, 40 to 50 grams per day is given. And in case of sheep and goat, 15 grams or 15 to 20 grams this soda bicarb should be given. So animal is given plenty of the, you can say, water, so that the indigestion may be acidic, alkaline, it will be neutralized, and it helpful in correction of the particular condition. So the second one is a constipation. Uh, so it is a sign rather than disease condition in case of the one or other diseases. The constipated animal cannot defecate for several, you can say, days, 1, 2, 3, or like that. And if he is defecate or the particular bull or bullock, cattle, buffalo, he or she is bulleting, this dropping, passing the stools, then the hard type of the stools they are obtained. This constipation can be generally treated by giving the enema. The simple treatment is that the common soap, body soap is available at anywhere on the farm or at any place. So take a warm water, dissolve a little quantity of soap in it, and pass into the anus of this. The quantity administered in case of the large animals is to around 200 to 250 ml, 300 ml, and in case of small animal, it should be 50 to 60 ml. So affected animals are then given plenty of the drinking water. Then purgatives like magnesium sulfate, edible oil can be suggested. So the other condition is a tympani. So abnormal expansion of the rumen, abnormal expansion of the stomach in case of the ruminants. Actually, it is of four compartments. So basically, rumen and reticulum, they are, I can say, expanded, or there is a gaseous formation in them, and indigestion is resulting in this, or highly fermentable carbohydrates if are taken by the animal, then this may result into tympany. Many a times it may happen that the kitchen wastes, the leftover food in the marriages or parties or any function, it is given to the animal. So this is a particular result into the high this more ingestion of the highly fermentable carbohydrates, and this produces the gas into the stomach of the animal, rumen of the animal, and this may result into the tympany. So most common sign, clinical sign which is observed in this is expansion of the left abdomen, left portion of the left abdomen. The animals feel strain while urinating and defecating, and rapid and difficult type of the breathing. So gas into the rumen, it causes pressure over the thoracic cavity and thorax, ultimately on the heart and lungs, and there is a difficult breathing. So animal may keep open mouth, protruding tongue out, and it can die. So if the pressure from the rumen is very huge, or more pressure is there, then it compresses the heart, lungs, and animal is unable to take the respiration, and death of the animal may be there. So restlessness, another signs like restlessness, kicking at the belly, frequent lying down and getting up, and enlargement of the left abdomen on the left side of the belly is available. So these type of signs are observed. So in case of this tympany, very simple treatment is a vegetable oil, 250 to 500 ml, depending upon the size of the animal. If the weight of the cattle is 500 and 600 kg, then it should be 500 ml. Or if it is a 250, 300 kg, then it should be 250 ml. And or paraffin oil, 100 to 200 ml is traditionally used to relieve the animals which are suffering from the tympany. Then the other treatment performed, primary aid treatment performed, is a massage to the left flank. Then turpentine oil, other treatment is turpentine oil 50 ml and vegetable oil 250 to 300 ml. It is mixed, and it is, you can say, fed to the animal, or it is given to the animal orally. Then tying, a simple treatment is, at the farm level, is tying a stick of neem tree, small stick of having length of 1 feet, horizontally into the oral cavity. Uh, uh, Oral cavity, it may result into the, you can say, uh, swallowing of the particular stick. It is a bitter in taste. So animal swallows the particular stick, and this will cause irritation of the gases, and there will be reduction of the tympany. So it should be tied from both the side with the help of the some halter or other type of the rope. So the other condition is impaction of the rumen. So impaction of the rumen means dense packing of the rumen with indigestible roughage, dense packing. So in this, in previous condition, there was formation of gas, but in this, the contents are densely packed into the rumen. The common signs appearing within 2 to 4 days after indigestion. The and the important sign is animal is completely off fed. Then if you palpate the left flank, then you will see that it is packed, impacted, and there are no movements of the rumen. The treatment is vegetable oil 250 to 500 ml, paraffin 100 to 200 ml, soda bicarb. Soda bicarb is also given 200 to 200 gram, 400 gram, or magnesium sulfate. It is available everywhere in the medical store. So it can be given in case of large animals 250 grams, and in case of sheep and goat near about 20 grams. The magnesium sulfate, soda bicarb, they should be mixed into the water. A 1 liter of the water or 2 liters of the water, they should be mixed and they should be given orally to the particular animal. Diarrhea. The other condition is diarrhea. The passage of loose stool and watery feces by the animal is called as the diarrhea. Increased frequency. So in a day, 5 to 6 times animal will pass such type of watery, loose type of stools. The consistency of the feces vary. It may be soft, it may be liquid, it may be solid, semi-solid initially followed by liquid, or it may be totally watery. So basically, this diarrhea causes this dehydration, loss of water from the body, and dehydration in case of affected animal. The other clinical sign in case of these animals which are having diarrhea, they are dullness, depression, lethargy, weakness, sunken eyes. So this, and if it is not treated, then condition may worsen and it may prove life-threatening to the animal. Diarrhea is caused due to infections or dietary reasons, basically. So many infections are responsible to cause this. If the diarrhea is due to dietary origin, the cause is corrected. If it is due to some infection, medicines are given. The simple treatment which is performed at farm level by the animal owners or farmers is chalk. Chalk means writing chalk. 50 gram gum which is available, the which is used for oral consumption, gum 20 panna 20 50 gram, and catechu 25 gram. So this is mixed. Chalk, gum, and catechu is mixed, and 25 to 50 gram of this mixture is given orally to the particular animal who is having the diarrhea. Other antimicrobials, other type of the remedies, they are to be performed. But this can be performed. This is non-harmful and this is very effective for treatment of the animals. Same way, the dose of this one in case of the goats is 20 grams. In case of large animals, cattle and buffaloes, it is a 50 grams, daily 50 grams. You can give it for 3 days. Digestive system of the animal must be given rest in case of the diarrhea, and easily digestible food should be given. Then plenty of the water should be given to overcome the dehydration, and uh, veterinary should be, can say, called for the treatment in case of very worst type of the condition. Then the other condition which is most commonly observed at the farm level is poisoning. Many type of the insecticide, pesticides, or any other type of the medicines, if they are applied on the body of the animal, if are accidentally poured on the body of the animal, or if they are consumed by the animal, it may result into the poisoning. So many a times a toxic substance or venom, snake venom, snake bite may be there, and these type of poisonings may occur. So in case of these poisonings, they are causing many poisonings. The majority of the poisonings, they are life threatening. So immediately veterinary care should be provided. The uh, effects of these poisonings are very bad if the treatment is delayed. Uh, Animal may swallow the poison, or it may be inhaled, or it may be absorbed through the skin. So even overdose of medicines, whatever we are giving, it may result into the poisoning. So usually farm animals suffer from poisoning by eating poisonous plant, accidentally by ingesting urea, rodenticide, pesticides, etc. So poisoning causes minor irritations like mild abdominal pain, dullness, salivation, depression in the animal. In several cases of the animals, take to refuses to take the food and water, and sudden onset of the poisoning is there, and it show the various type of nervous signs like muscular trembling, convulsions, excessive frothing from the mouth. So So if it is not treated in time, then this animal may die. So in case of snake bite and all these things, immediately veterinary pro health should be provided. Anti-snake venom and serum and these all the things are required. But in case of the other type of the poisoning, uh, purgative drug are given in case of the affected animals, so that the medicines will be passed through the feces. So under the field condition, animal is fed with the activated charcoal, acts as a universal antidote for poisoning. So what activated charcoal does, it is whenever it is given orally, then it doesn't allow absorption of the poisoning into the body. So 1 to 2 gram per kg of the body weight, it should be given, or 0.5 to 1 gram subsequent doses. The first dose is 1 to 2 gram. If the weight of the animal is 300 kg, 300 gram, 400 kg, 400 gram, such type of activated charcoal should be given orally immediately after consumption. If you, once you know, note that the poison is consumed by the animal. Then if there is a, you can say, poisoning through the skin, if some poisonous substance is sprayed over the skin, or accidentally it is fallen over the skin, then the skin of the animal should be washed with plenty of the soap water, so that all the layer of this poison on the skin will be removed, and there will be the signs of the poisoning which will be subsided. Expert veterinary care is essential. So, uh, as I told you, that in case of some very serious or life-threatening type of the poisoning like snake bite or other poisonings due to pesticides, immediately veterinary care should be provided. So these treatment may not work. So for simple reasons and the plant poisoning and these things, they may work, or a little mild type of the poisoning, they may work. Or this will not be useful in case of the, I can say, very severe type of the poisoning or any bites by the poisonous, I can say, animals. Sunstroke or heat stroke. So sunlight, it may cause, you can say, sunstroke, and heat stroke may also responsible. Excess type of the humidity in the environment may result into the heat stroke. So the sunstroke or heat stroke, uh, excessive muscular exertion of the animal in a high environmental temperature, means if you are animal this farmer is taking the animals for agricultural work in the this one uh, sunlight, or in case of the extreme heat, or in case of humid environment, then also it may result into the sunstroke, heat stroke. The hyperthermia, in case of the sunstroke or heat stroke, hyperthermia is the main clinical sign. The temperature of the body, if we check the temperature, then it will be above 104 degrees centigrade, 104, 105. And increased heart rate, increased respiration rate, restlessness. So these type of signs are observed. Hyperthermia causes difficulty in breathing and convulsions. Many times, if the high temperature is there, it may result into the convulsions and death. So, the affected animal is moved immediately into the shaded area and well ventilated area. The second is water is poured on the body of the animal, and adequate glucose and water is given to the animal, particular animal orally. The cold water is given to the animal for drinking. The cold water enema is also given. So this can be performed at, can say, field level. So to bring down the temperature down, and you can say immediately veterinary care should be provided in case of severe cases. The other condition is burns. Many a times, the by catching the fires to the premises, seeds, or any, can say, objects in the farm, There may be burn injury may be observed in case of the animals. So injuries means any type of the thermal injuries which is caused by fire or flames or hot solids. So these are called as the burns. So hot fluids, steam are also called as the scalds. So burn due to hot steam or fluids are called as scalds. The chemical burns occurs due to acid, alkali, and any corrosive type of the chemicals. The extent of the burn depends upon the temperature of the object, number one. Number two, duration of the time in which this uh, hot substance is came in contact with the animal, and you can say thickness of the skin, that is also very important. In case of first degree burn, only superficial outer layer of skin is involved, and this is a mild type of injury and recurs within few days. In case of second degree burn, partial thickness of the skin is involved. Vesicles are formed. For early or complete recovery, special care is taken to prevent secondary infection. So, uh, vesicles is the main clinical sign or sign observed in this. In case of third degree burn, the full thickness of skin is lost or burned, and underlying organs, underlying tissues, they also burn. So these are the types of the burn. In case of treatment, local dressing of the burn with antiseptic. The antiseptics like silver products, silver sulfadiazine or silver X ointment, or many times nano silver particles, the spray, they are available in the market. So these type of the silver containing compounds can be used for treatment of this, and this may cause fast relief or fast healing in case of such type of wounds. The contamination is prevented. Contamination of the wounds is prevented by covering the area with a clean and sterile cloth. Sufficient water and glucose solution is given to the animal. So in case of burn, there may be water loss, there may be dehydration. So this should be given. In case of chemical, acid, alkali, corrosive, wash with plenty of water. In case of any acid, alkali, or corrosive chemical, wash with plenty of the water, and this water will neutralize the effect of the particular poison, corrosive poison. Then wounds. So basically, these wounds may occur at the field level, and it is nothing but in the break in the continuity of the skin. So any skin, you can say, is broken, cut, blow, or other impact, it may result into the wound. So there are so many types of the wound. So the primary treatment for this is bleeding. In case of bleeding wound, different methods are recommended: pressure, tourniquet, and application of the cold. Pressure bandage is tied, tourniquet is applied above the bleeding part, and cold fomentation is given. Cold, you can say, colds, they are applied. Cold water or ice, it is applied on the particular wound, so that the bleeding will be stopped in case of fresh wound. The injured tissues are carefully examined for any type of the foreign objects or particles such as hair, dirt, gravel, pieces of the wound, wood, nails, etc. So if they are there, then with the help of the normal saline, they should be washed carefully. And local treatment consists of cleaning and washing the part daily and applying antiseptic ointment, lotion, or powder over it. So if the treatment of the burn is performed in time, the further infection can be prevented, and further formation of maggots and these complications can be prevented. So basically, cleaning of the wound, irrigation with the help of the normal saline, then application of the antiseptics, and if it is extensive wound, then you can apply the bandage over it, so that the secondary bacterial infection can be prevented. So these were some conditions which are occur. Along with this, there are so many other type of the treatments which are performed in case of the inflammation. Inflammation means swelling, getting swelling over the particular part. So in case of the acute inflammations, means in case of the recent injury, in case of fresh injury, uh, mm, and there is no wound, only swelling is there on the skin. So you can perform the treatment with the help of the cold water. Cold water, fill the cold water in the bottle, and we can say give cold fermentation, or use ice packs and keep the ice packs over the particular part for 5 to 10 minutes daily for 3 to 5 days. If it is a old type of the swelling, if it is old type of the inflammation or injury, then it can be treated with the this one hot type of the therapy, hot fermentations. And for that, you can use the uh, hot water bags, hot water bath, or hot fermentation. So the temperature of water should be 44 to 46 degrees centigrade. Means the temperature of our body is 37 degrees centigrade, and it should be little 4 to 5 degrees more than that, so that it can be well tolerated by the animal, and the treatment of the particular inflammation or swelling can be performed in time. So thank you. This was my short presentation. So any any question on this?